Hi there, I'm Teresa Dufour with the CT Style Express Report. Enrolling in Medicare can be confusing with a lot of options to consider. Here to break things down for us is CEO of UnitedHealthcare, Medicare and Retirement, New England, Mary Snyder. Mary, thanks for making time for us via Zoom.
Hi, Teresa. Thanks for having me.
All right, so for seniors and other people enrolled in Medicare, why is this annual enrollment time such a big deal?
Yeah, so choosing a Medicare plan is one of the most important decisions a person can make, not only for their health and well-being, but also for their wallet. And for most people, this is the only chance they have during the year to change their Medicare coverage. If they don't make an enrollment decision, they might be locked into their current plan. And if anything has changed with that plan or with their own health or finances, that decision to do nothing could lead to unpleasant surprises or even some missed cost savings opportunities.
So Medicare annual enrollment, we've heard that it can be overwhelming. So what advice do you offer to help make the process of choosing a plan a little bit easier?
Yeah, so choosing a Medicare plan can feel complicated, but it doesn't have to be. We're here to help you navigate the process and find a plan that meets your needs. You'll want to take the time to explore options and understand benefits and costs of all of your plan choices. I always encourage people to start early. Look at your current coverage and first see if it still meets your needs. Then determine if it's still a good fit for your budget. And you want to pay attention to more than just monthly premium. You also want to understand things like out-of-pocket costs, including deductibles, copays, and coinsurance. With UnitedHealthcare, for example, almost all Medicare Advantage plans will have $0 copays for primary care visits, telehealth visits, labs, routine vision, and hearing exams, as well as preventive screenings like colonoscopies and mammograms. So in addition to no and low premium plans and those $0 copays that drive coverage affordability, UnitedHealthcare also offers broad access to plans that limit monthly out-of-pocket costs on insulin, $35 per prescription for all covered insulin. So that's a really important consideration, as well as just making sure that all of your medications are still covered.
Right. So what are some things people should look for in a Medicare plan to help them stay healthy, especially during COVID-19 and the pandemic?
Yeah, so it's more important than ever during times like these to have stability and peace of mind when it comes to health care and coverage. You know, Teresa, the COVID-19 pandemic has profoundly altered the healthcare landscape. And while it's changed so much for so many of us, at UnitedHealthcare, it did not change our commitment to helping people access the care they need, whether in a healthcare setting or at home. So it's essential that people don't put off needed care. And that's something we've seen across the country in recent months. You know, a recent CDC survey found that 40% of adults in the United States have delayed or avoided medical treatment during this pandemic. Your Medicare coverage is set up to help ensure you have access to the care you need, even and especially during these times. So in addition to providing access to doctors and hospitals, your Medicare coverage can also just help you live a healthier life and achieve your health goals. So you'll first want to confirm that your doctors and hospitals are available through the plan you're considering. Most Medicare Advantage plans do also cover telehealth visits. So confirm that that coverage is available as you're exploring your options. Most UnitedHealthcare Medicare Advantage plans also include house calls. That's a program that offers people a free yearly visit with a licensed clinician from the comfort of their home, really helping to coordinate needed care, including, coordinating with that individual's primary care doctor, as well as conducting health screenings and providing education on the management of chronic conditions. So one thing that people do tend to forget about are other benefits besides just medical. So you don't want to forget about dental, vision, and other benefits that can come with your plan. And there's also wellness programs. I think, while a lot of people haven't necessarily been going to the gym during this pandemic, UnitedHealthcare's Renew Active fitness program does include just an incredible amount of online resources, again, to help people stay healthy.
Right. And I know that Medicare Advantage is a more popular plan. What is kind of driving that growth?
Yeah, so Medicare Advantage, which is also called Medicare Part C, it combines Parts A and B into one plan, and it's offered by private insurance companies. It also typically includes Part D, which is prescription coverage. You know, 10,000 Americans are turning 65 each day. And while the aging baby boomer generation is clearly contributing to this explosive growth, Medicare Advantage enrollment is rising rapidly, even when just adjusting for that age weight. And it's really because of those added benefits that give people more than just regular original Medicare does. You know, Medicare Advantage enrollment has grown more than 40% over the last 5 years, and it now covers about 1/3 of all Medicare beneficiaries. What makes Medicare Advantage appealing to so many people, too, is just the value and simplicity it offers. It's the convenience of combining all your coverage into one plan, and those additional benefits that I mentioned: vision, hearing, dental care, fitness memberships, and then disease management programs too, among many other benefits.
Sure. And Mary, I just want to ask you, where can people go to learn more and to start this whole process?
Yeah, so there's a lot of great resources out there to make the process of choosing a Medicare plan easier. So if people would like more information about UnitedHealthcare plans, they can visit uhcmedicarehealthplans.com or call 1-800-989-1981. And then for just information about Medicare in general, visit gettoknowmedicare.com.
Very good. Mary Schneider, thank you so much for all of the information. Now's the time to take part in the annual enrollment. We appreciate it.
Thanks, Teresa.
Sure.